Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about baby ear infection, causes, symptoms, treatment. Today's video looks at how ear infections affect babies, what causes them, what symptoms to look for, when you should take your baby to the doctor, what can be done so that your little one feels better. Your baby has been battling a cold. Now they're tugging at their ears and acting fussy. Last night they didn't sleep so well, either. Of course, they can't tell you what is wrong, but you can't help thinking they might have an ear infection. Could it be true? If so, how serious are ear infections in babies? And what should you do next? The good news is that ear infections are very common among children under the age of 2. And they are also generally very treatable. What causes ear infections in babies? Ear infections, medically known as acute otitis media, are infections of the middle part of the ear. They are caused by either a viral infection, like the common cold, or a bacterial infection. These infections cause fluid to build up in the middle ear, as well as inflammation. In some cases, the eustachian tubes, the small tubes between the nose and middle ear, show signs of infection as well. Adults can get ear infections, too, but babies and young children are most prone to them, especially children under the age of 3. 5 out of 6 children will have had an ear infection by the time they turn 3, 1 and 25% of children will experience repeat ear infections. The reason babies and young children are more prone to ear infections include: babies' ear passages are different than adults, they are shorter, narrower, and more horizontal in orientation. Babies are more likely to get colds and other viruses, which make them more prone to ear infections. Babies' immune systems are less developed than adults, so their reactions to virus are usually more intense, leading to complications such as ear infections. Symptoms of baby ear infections. Many parents will notice their baby tugging on their ear or simply acting fussy and assume that they have an ear infection. However, while ear tugging and fussiness are sometimes signs of ear infections, they can also be the signs of teething, or just general crankiness. Let's look at all the possible signs of baby ear infections, and how to know whether it's time to contact your pediatrician. Early signs of infection. The symptoms of ear infections usually come on suddenly and are first experienced as discomfort, pressure, and pain. Of course, your baby can't describe what they are feeling, which makes it hard to know what's wrong. At first, your baby may just generally be more fussy and inconsolable. Soon after, you may notice your baby tugging on their ear, or having trouble sleeping. Lying down often causes the pressure and pain in the ear to worsen, so you may notice that your baby can't sleep for very long stretches during this time. They may also have trouble breastfeeding or bottle feeding, as suckling and swallowing can also sometimes worsen their pain. As the ear infection progresses, they may develop a fever or experience drainage from their ears. Symptoms of ear infections in babies. There are many symptoms that may indicate an ear infection. Again, just having one of these symptoms doesn't always mean your baby has an ear infection. But if your baby has several of these symptoms together, and especially if they have recently had a cold or other virus, you can suspect that they may have an ear infection. Crankiness and fussiness due to discomfort and pain, trouble sleeping or lying down flat, pulling at the ears from pain, fever. Not all babies have fever with an ear infection, but many will have a fever between 100 degrees Fahrenheit or 37.8 degrees Celsius and 104 degrees Fahrenheit or 40 degrees Celsius. Decreased appetite due to fever, pain, or discomfort while swallowing or suckling. Digestive discomfort. Clumsiness due to ear balance issues. Yellow or brownish fluid draining out of your baby's ear. Difficulty hearing or responding to the sound of your voice. This is due to fluid buildup in the ear and should resolve after the ear infection is over. Treatments for baby ear infections. Ear infections can be upsetting for both babies and their parents, but most are treatable, and mild infections may diminish on their own without medicine. Either way, if your baby is experiencing an ear infection, your doctor will discuss remedies to help ease their pain and discomfort. Should I take my baby to the doctor? Even if you are unsure if your baby is experiencing an ear infection, it's better to err on the side of caution and call your doctor. If they do not believe there is an issue, they may tell you to stay home. However, since baby ear infections are so common, it's likely they will have you come in for an exam. There is no harm in getting things checked out. The worst that will happen is that your baby doesn't have an ear infection and you can feel some relief. What will happen at the doctor's office? If your doctor thinks your baby may have an ear infection, they will certainly examine your baby's ear canal, but they will also likely look at other possible symptoms. Here's what will happen during the visit. Your doctor will ask you what viral or infection symptoms your baby has had recently. Your doctor will ask you what symptoms your baby has been experiencing, and will check your baby's vital signs. Your doctor will take your baby's temperature. Your doctor will listen to your baby's lungs for signs of respiratory distress. Your doctor will examine the inside of your baby's ears. Here's what an examination of your baby's ear canals may entail. Your doctor will view your baby's middle ear using an instrument called an otoscope. They will be looking for signs of redness and inflammation. Babies usually don't like this, but the procedure is not painful. If your doctor wants to check for fluid buildup in the ear, they will use a pneumatic otoscope. This will blow a small amount of air inside your baby's ear. This is not harmful or painful, but again, your baby may not like it very much. If neither of these procedures offer your doctor a definite answer, they may use a tympanometer to examine your baby's ear. This uses air pressures and sound tones to measure the pressure inside your baby's ear. What medications are used to treat baby ear infections? Traditionally, ear infections were treated with antibiotics like amoxicillin. However, in more recent years, doctors have adopted a wait-and-see approach to prescribing antibiotics, at least for kids 2 years old and up. Most of the time, babies under 2 need an antibiotic. If your baby is prescribed an antibiotic, it's important to give it for the full prescription course, usually 7 to 10 days. It's likely that your baby will start to feel better within a few days, but if you stop the medication before the course is done, you risk the infection returning. Many pediatricians recommend giving your baby probiotics while they are taking antibiotics. In doing their jobs, antibiotics kill both good and bad bacteria, and the depletion of good bacteria can sometimes cause digestive discomfort. Probiotics can replenish the good bacteria your baby needs, and ease any digestive upset. It's always distressing when your baby is uncomfortable or in pain, and it's common for parents to become very worried, even from something as common as an ear infection. You should know that so many other parents have been there too, up all night with a cranky, sleepless, and feverish little one suffering from an ear infection. Again, if you suspect that your baby may be suffering from an ear infection, it's always better to be safe than sorry. Call your pediatrician for advice or for an appointment. Chances are, your sweet baby will be feeling better in no time. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.